to apropos. Well, superbugs that are resistant to antibiotics will kill more than 39 million people worldwide over the next 25 years. That's according to a new study published in The Lancet. Antimicrobial resistance occurs when pathogens develop the ability to evade the medications used to kill them, and infections that were once easy to cure with antibiotics become untreatable. Jean-Emile Jamin has the details.
Antibiotic resistance, a problem reaching crisis levels. According to a recent study published in The Lancet, over 39 million people could die from drug-resistant infections in the next 25 years if urgent action isn't taken. And it's not just direct deaths. The study warns of an additional 169 million lives lost indirectly due to complications associated with antibiotic resistance. For perspective, by 2050, researchers say deaths associated with antibiotic resistance could increase by up to 75% from what we're seeing today. The study also highlights how low and middle-income countries are set to bear the brunt of the crisis, especially in sub-Saharan Africa and South Asia. These regions already experience the highest rates of antibiotic resistance-related deaths, driven primarily by infections like multi-drug resistant tuberculosis. The elderly are also most at risk from antimicrobials, with deaths up by 80% in the past 3 decades amongst over 70s. And the economic impact is equally concerning. Researchers predict that by 2030, the global economy could suffer losses of up to $3.4 trillion annually. The ripple effects of this burden could strain healthcare systems and hurt national economies, particularly in countries that can least afford it. The report suggests that measures like improving care for serious infections, developing new vaccines, and promoting judicious use of antibiotics could save up to 92 million lives between now and 2050. These findings come just days ahead of a UN General Assembly meeting on the issue, highlighting the urgent need for global cooperation.
For more, we're joined now by Professor Ben Cooper from the Centre for Global Health Research at Oxford University. He's also one of the authors of the report. Thank you so much for being with us on the programme this evening, Professor. So firstly, what has gone so wrong with how these drugs are being prescribed and used?
That's a good question. I think over a number of years, we got used to having lots of new antibiotics being developed all the time. So, and what's happened in the last 20 years is that pipeline of new antibiotics has really slowed down. So now it's really just a trickle of new antibiotics coming through. And at the same time, the bugs have been evolving resistance to the antibiotics that we already have. And in many parts of the world, the way we use antibiotics is actually very careless. There's lots of unnecessary use of antibiotics for treating viral infections where they're not effective at all, or using them in animal production. And all these actually make a contribution to the problem.
Now, according to the report, by 2050, not far off 2 million people will be dying from illnesses attributed directly to antibiotic resistance each year if remediation measures aren't put in place. So what exactly needs to be done?
Yeah, so I think there are really 3 things that we can do. The first thing is that we can expand on measures to prevent bacterial infections. And we have seen some positives. So our study found there's actually, in the under 5-year-olds, there was a reduction in deaths due to antimicrobial resistance. And that reduction occurred because we are able to stop infections by using vaccines and using better hygiene. So we really need to think very carefully about how we can increase the use of vaccines to prevent infections, and also increase hygiene measures to prevent those infections spreading, both in hospitals and in community populations. So that's one thing. The second thing we can do is be much smarter about the way we use antibiotics. So we can develop and use more rapid tests to actually determine very quickly whether bacteria causing infections can be treated with different antibiotics, and we can target them appropriately. And we can also reduce the inappropriate use of antibiotics. And there are specific targets that many countries are aiming to achieve in this. And The third thing we can that we can do is really invest in the development of new antibiotics. And the difficulty there is that these are not a profitable product for pharmaceutical companies. So really in the last 20 years, we've seen pharmaceutical companies not investing in this area. So we need to make incentives so it makes it worth the while of pharmaceutical companies to actually invest in developing new drugs.
And Professor, we often see doctors, as you say, being blamed for over-prescribing antibiotics, patients for demanding them. But some experts say there's also another factor at play, and that's the manufacturing process, where pharmaceutical companies, they often dump antibiotics into wastewater. So what can be done to guard against that practice? You've also mentioned it yourself earlier then as well, antibiotics also being used to illegally promote animal growth.
Yeah, it's certainly an issue that some factories are dumping antibiotics into wastewater. There's also runoff from agricultural use of antibiotics. And certainly these are areas where better regulation and better enforcement of regulation is needed. There's also a problem with actually companies making fake or substandard antibiotics, which still have some active ingredients, which can also promote resistance. So there's also a sort of really illegal element of this, which may be making a contribution to the problem as well.
And global leaders are due to meet at the UN General Assembly in New York later this month to discuss this very issue. Are you hopeful that there may be some progress made there? What exactly should governments be doing in the short term?
I am hopeful. There have been a lot of positive signs, and there have been most countries now have national action plans to do something about the problem. And I think there is, in a number of countries, a real political will to do something. So I'm optimistic that decisions will be made to take real action for this. I guess what we'd really like to see is to make sure that the investment which is really needed to tackle the problem goes along with that.
And Professor, in a worst case scenario, I suppose, are we headed, as some experts would warn, for a so-called post-antibiotic era in which common infections, minor injuries that have been treatable for decades can no longer be cured and can once again kill patients?
I think this is a real risk, and I would say also that that's already happening in some countries. So there are some countries where the last resort antibiotics that could potentially treat these resistant infections are not available or not affordable to patients. So right now, patients are dying because they have effectively untreatable infections. So we're seeing that less frequently in high-income countries, but that's certainly a risk that could happen, yeah.
And which parts of the world then are worst affected? The reports that tens of thousands of newborn babies are dying each year in India because of antibiotic-resistant infections there. So as you say, this is something that's happening right now, and we're not just talking about something that's possibly going to be happening in 25 years' time.
Yeah, that's absolutely right. I mean, the worst affected countries are certainly the lower income countries. And the problem there is compounded. It's not just about resistance, it's also about lack of access to effective antibiotics. So kind of essential medicines are often not available in hospitals there as well. So those countries that also have the highest infection rates and compounded by the lack of effective drugs and drug resistance kind of makes a perfect storm, really. Yeah. So that's clearly where the largest problem is. And that's also where the problem is predicted to grow the most in the next 25 years or so.
And in terms of just on an individual level, you know, if patients going to the doctor and they might be demanding an antibiotic to treat various ailments that they believe that they have, do people need to be better educated when it comes to antibiotics and also about how these drugs should be disposed of safely?
I think there's certainly a role of education and we know that there certainly are problems where doctors feel under pressure to prescribe antibiotics where they're not really needed. So certainly sort of national education campaigns can play an important role in this.
And just finally, Professor, who's the most at risk here? Are we speaking, obviously, of vulnerable people, but really it's older generations who are most at risk when it comes to this?
That's absolutely right. And that's one thing that the report highlighted, that the biggest increase in risk has been in the over 70s. And a large part of the forecast increase, if appropriate measures aren't taken, is due to sort of demographic changes and the aging population. So as we see more people in that over 70 age bracket, that's where the real greatest risk is.
Okay, Professor, thank you so much for joining us. That is Ben Cooper from the Centre for Global Health Research at Oxford University. We do really appreciate your time on the programme this evening, one of the authors of that report in The Lancet.
Thank you very much.
That is it from us for now. Do stay with us, though. Up next, it's Eye on Africa.